Dear ladies and gentlemen, my name is Viet from Hanoi Medical University, Hanoi, Vietnam. I would like to introduce about the updated Chicago 4 of esophageal motility disorders. So the first version of Chicago provided a methodology approach to classify the esophageal motility disorders using HRM in 2008. And then we have the second and the third Chicago, and we are familiar with the Chicago 3 in 2016. And in 2020, the Chicago 4 was born. So what is new in the Chicago 4? The first thing is about the new protocol. In the Chicago 3, we only use the supine position for all the wet swallows. But in Chicago 4, we could use both supine and upright positions. And one more thing is that the provocative test must be included in the protocol procedures by Chicago 4. So when the patients performing HRM, they will be perform 10 supine water swallows and then 10 upright water swallows. And according to the different symptoms of the patients, it could be the symptoms of obstruction, or could be the symptoms of reflux, or the postprandial symptoms. We could use the specific provocative test. For example, if the patients present with obstruction symptoms, we could use the meal or the rapid swallow test in the provocative procedures. And if the patients have the symptoms of reflux and we suspect they might have the hypomotility disorders, we can suggest the patients to perform the single solid swallows or the meal test or the multi-rapid swallow. Or if the patient having the symptoms increasing after the meal, we can perform the meal test. With the provocative test, it is easier to clarify and to explain the symptoms combined with the manometry results. Another thing is that there are several diagnostic criteria modified in Chicago 4. For example, for IEM, the cutoff of 50% of ineffective swallows was changed to 70% of ineffective swallows. All patients must have at least 50% of failed swallows. And the second thing is that Chicago 4 emphasized the presence of significant clinical symptoms in patients with DES or with the EHGC outflow obstruction or the hypercontractile esophagus. And I would like to focus for the take-home message. There are three important things. The first one is Chicago 4 is the state-of-the-art classification scheme for esophageal motility disorders. The second thing is that the protocol in Chicago 4 includes two positions and provocative test. And the last one is that the HRM diagnosis should be combined with the clinical symptoms and other functional explorations to get a conclusive diagnosis. Thank you for your attention.